All right, so you want to talk about COVID's impact on dental care, specifically in Latvia.
So it's intriguing.
We're diving deep into a 2024 research paper from the Latvian Academy of Sciences, all about how dental visits were affected in 2020 and 2021.
That period was fascinating for healthcare. So many rapid changes.
Exactly. And this paper it really digs into the data, charts, graphs, the works. But lucky for you, our experts here to decode it all. So what's the biggest takeaway? What jumped out at you?
You know, the researchers found a direct link between government restrictions, the lockdowns and such, and how many people actually went to the dentist. During Latvia's first wave of COVID, there was a huge 81.6% drop in people going in for routine dental care.
81.6%.
Seriously.
Yeah, a massive drop.
Wow. I mean, that really puts things into perspective. It's easy to forget how ingrained our routines are, like going to the dentist, until something throws them completely off track. We're talking about their first wave here, right? When case numbers were still relatively low in Latvia compared to later. Exactly. And to really understand this trend, they actually categorized all the different dental procedures based on how likely they were to generate aerosols, those tiny particles that can carry the virus.
Ah, okay.
So emergency procedures, things like tooth extractions, those didn't decline as much. I mean, you can't exactly ignore a dental emergency, right?
You got to get those taken care of no matter what.
Exactly. But routine care, though, things like cleanings, x-rays, fillings, those plummeted during that first wave.
So it's not even necessarily about being afraid of catching the virus during a specific procedure then, but more about the overall rules and restrictions, creating this barrier to just going to the dentist. Did it ever go back to normal?
Well, not exactly. It's
Yeah.
not that simple. After that initial, I guess you could call it a shock, of the first wave, things did bounce back, surprising how quickly, actually. But QIT, when the second and third waves hit, noticeable dip again, even though the restrictions were less strict those times.
So even with lighter restrictions, people were still hesitant. It makes you think they carried that fear and uncertainty from the first wave, maybe being extra cautious on their own, canceling appointments if they even thought they felt a little off. Speaks volumes about how these kinds of events can have a lasting impact on our healthcare behavior.
Couldn't agree more. And it's interesting. You'd think a global pandemic, right? The perfect time for something like teledentistry to really take off.
Right. Virtual appointments, get advice from your dentist, maybe even a diagnosis, all from home. You wouldn't even have to be in the same room. Seems ideal when everyone's worried about, being near each other.
Exactly.
Well,
Seems like a no-brainer, right?
Totally. So, did it happen? Did teledentistry take off in Latvia?
That's the thing. Not really. The researchers, they found that teledentistry, even other non-invasive treatments, they didn't really gain much traction at all during this whole period.
Okay, so why not? If it was seemingly the perfect solution, what happened? Did the study give any explanations?
Well, they had a few ideas. Funding was a big one, seems like. Setting up all that new tech, the systems for teledentistry, it takes money. And during a pandemic, resources, especially in healthcare, they're stretched pretty thin as it is.
That makes sense. You can't just expect every dentist to have the equipment and know-how for virtual appointments overnight. It's a big ask. And even if they have the tech, it's not just about the technology itself, is it? You need people who know how to use it, right?
You're absolutely right. The study, it actually points out that dentists might have needed more training to really feel good about using teledentistry. It's a whole new way of doing things, and there's always a learning curve with new technology, especially in healthcare.
Yeah.
You're dealing with people's health, after all.
For sure. So we've got the funding, the training, but then there's also the patients themselves. Were they hesitant to embrace this new way of doing things, to, actually try teledentistry?
It's a good question. And the study seems to think that patient perception might have played a part in the slow adoption. Because for teledentistry to work, you need both sides on board, right? The dentists and the patients.
It's a two-way street. So even if some dentists were ready and raring to go with virtual appointments, if there wasn't enough demand from patients. Well, it makes you wonder why that hesitancy was there. Was it just not knowing teledentistry was an option, concerns about how effective it could be, or maybe some people just prefer that face-to-face interaction with their dentist, even if a little closer than they'd like right now?
Yeah, that's probably a mix of all those things, honestly. And it's important to remember that teledentistry, as cool as it is, it's not a magic bullet. It has its limitations.
Right, you can't exactly get a virtual filling yet.
Exactly. It's definitely more for those initial consultations, follow-ups, answering some basic questions, that kind of thing. So it's not going to replace in-person care completely, but it can be a really helpful addition, potentially even mean fewer trips to the dentist for some things.
So it's less about replacing the old way and more about having more tools in the toolbox, so to
Sure.
speak.
Exactly.
Sounds like we need more awareness then. Education about what teledentistry can and can't do, both for patients who might actually benefit from it and for dentists who might be on the fence about using it. It's like we keep hitting on this, right? It's not just about the shiny new tech, but the whole picture, the infrastructure, who's trained to use it, who even knows about it.
It's a whole ecosystem, right? And that actually brings us to another big thing this study brought up, how dental care is funded,
Yeah.
the way it's structured even.
Yeah.
They argue the traditional model, where dentists basically get paid for each procedure they do. Kind of works against preventative care, if you think about it.
Interesting. So instead of getting paid for like every filling or extraction, which means focusing on fixing problems that are already there, we should be rewarding the stuff that keeps those problems from happening in the first place.
Exactly. The study actually mentioned this concept. It's called paying for health in dentistry. Basically, aligning those financial incentives with, what's actually best for the patient in the long run. Makes you think, fewer fillings, fewer extractions down the line? That's better for everyone.
Makes a lot of sense. So did they find any evidence of this paying for health model actually, happening in Latvia during the pandemic?
It doesn't seem like it, unfortunately. They found the use of preventative stuff, like cleanings, fluoride treatments. It all went down at a pretty similar rate to everything else, especially during that first wave we talked about.
Wow. So even though everyone agrees preventative care is important, the way things are set up doesn't really reflect that. Why do you think that is? Did the researchers have any thoughts?
Well, they pointed out that changing those really ingrained systems, healthcare especially, it's really hard. Takes time, takes resources. Everyone involved has to be on board. The pandemic, as disruptive as it was, might not have been enough to completely change those practices so quickly.
Right. It's like even when there's this huge, obvious reason to rethink how we're doing things, the change doesn't just happen overnight. It's more than just realizing something needs to change. It's actually doing it.
100%.
Yeah.
And I think this study really highlights just how complex these systems really are. It's not just about the dentist and the patient. It's the government, public health, technology, funding, people's anxieties.
Yeah.
It's everything all at once.
Whoa, yeah, like a giant web, right? Everything's connected. And speaking of connections, this study got its data from Latvia's public dental system, yeah? Did the researchers mention any limitations there with the data they were looking at?
Yeah, they did point out that Latvia, like many countries, it doesn't have this perfect centralized electronic system for tracking all dental care. So what they mostly looked at was data from the National Health Service there, which is primarily focused on publicly funded care. So kids under 18, mostly.
Got it. So it represents a big chunk of the population, but not necessarily everyone going to private practices and all that. Important to keep in mind. But even with those limitations, this data is still super valuable, right, for spotting those larger trends.
Oh, absolutely. It's a snapshot,
Yeah.
of how a healthcare system, in this case Latvia's, dealt with something as massive as a pandemic. We can't just assume these findings apply everywhere else, but it does make you think about some bigger questions that do apply more broadly.
That's what I was thinking. What are some of those big takeaways, things we can learn from Latvia, even if our healthcare systems are different?
One thing that really stuck with me is just how vital it is to have good data in public health. Being able to track what's going on, see where things are going wrong, and make decisions based on, evidence. That's huge, especially during something like a pandemic.
Data-driven decisions, for sure.
Wow.
What else?
The other big theme for me is how interconnected everything is. Like public health and just life, society. Remember how we talked about dental visits dipping again in those later waves, even when the rules weren't as strict? That suggests it wasn't just about the official guidelines anymore. People were making decisions based on their own experiences, what they were worried about, all that.
It really highlights the importance of clear communication, doesn't it? People need accurate information to feel comfortable making decisions about their health, especially when those decisions affect whether or not they'll even seek care. What else stuck out to you?
The study really underscored the need for healthcare systems to be adaptable.
Right, being able to roll with the punches, to change when they need to try new things and find new ways to get people the care they need when the old ways aren't working anymore.
Exactly. Like teledentistry. Having those options available helps bridge that gap when in-person care isn't possible or safe.
And having those options ready to go means investing in the research, the tech, making sure healthcare providers are trained and ready to use these new tools. It's about giving healthcare systems the tools they need, not just to survive a crisis, but to come out stronger on the other side.
Exactly. Which brings us right back to all those interconnected pieces we talked about, right? The
hmm
data, the tech, the policies, how people behave, who's paying for what.
A complex web indeed. But I got to understand how it all fits together if we want to build healthcare systems that can weather these kinds of storms. Speaking of the human side of things, though, we haven't really touched on the dentists themselves. How did the pandemic affect them? It's easy to get lost in the big picture sometimes, all the data, the policies, the tech. But at the end of the day, healthcare is about people taking care of people. What did the study say about the dentists themselves? How'd they handle all this?
The study really highlighted just how much pressure they were under. Think about it. New safety protocols all the time, supply chain issues, not to mention dealing with their own worries and their patients' anxieties. It was a lot.
It really makes you appreciate the people in the healthcare, doesn't it? They just keep going, keep showing up for people, even when things are tough. Did the study talk about any kind of, I don't know, long-term impact, like on dentistry as a whole?
They actually made a point of saying, we focus on 2020, 2021, but this is going to have ripple effects for years to come. It's not over just because the calendar flipped.
Totally. I mean, we're all still feeling the effects of the pandemic in different ways. Did they have any suggestions for like building a more resilient system going forward
Right.
for dental care
Yeah.
specifically?
Yeah, they had a few key things. First, invest in teledentistry, the infrastructure, the training, all of it.
Not just a quick fix, but a long-term solution could really help with access to care, especially in places where it's hard to get to a dentist regularly.
Exactly. They also said more research. We need to know what the long-term impacts are, especially for things like oral health. Like, if people missed appointments, delayed care, did that lead to more problems down the line? We need to know.
Connecting the dots, figure out the consequences, then you can start to address them, right?
Right. And then this one kept coming up. We have to move away from just paying for procedures and start rewarding preventative care, prioritizing people's long-term health. That paying for health idea.
Makes sense, but it's a big shift. It's about changing how we value those things, prevention, early intervention, putting the patient's well-being front and center. It's a lot, but if we want a better system, that's the conversation we need to be having.
For sure. And I think that's what's so great about this study. Yeah, it's about Latvia, about dentistry, but it gets you thinking about those bigger themes. It shows where healthcare systems are vulnerable, how important data is,
Yeah.
the need to be flexible, to change. And at the heart of it all, it's about people.
Taking care of each other. So even with all the challenges, there's always room to learn, to grow, to build something better. And if you want to dive even deeper into all this, we highly encourage you to check out the full research article. We'll have a link for you in the show notes. That's it for this deep dive, but keep those brains buzzing. Until next time, stay curious.